Hi everyone, my name is Thanh, and today's date is December 16th of 2025. And today I'm going to tell you something about the micronutrients with the vitamins and minerals. So after this video, you can explain how reference intakes that you would have, and you can compare the fat soluble and water soluble vitamins with its function, absorption, and storage. And you can also describe the key vitamins, mineral, the roles, the deficiency sign, and the toxicity risk. Okay, so for vitamins, they are organic compounds we need in the smallest amounts because our body can make it enough. And many vitamins act as coenzyme or regulators of gene expression. And besides that, minerals in organic elements like iron, calcium, iodine, zinc that serve structural roles and act as an enzyme, cofactor, or electrolytes. If you have too little of those, you can cause deficiency and some diseases. But if you use it too much, especially from like the supplements, you can also do harm to your body, and also it's have some toxicity in your body. And then for the fat soluble, what is vitamin A, D, E, and K, they are absorbed with dietary fat and packed into lipoprotein because they can be stored in the liver and body fat. Deficiency can develop slowly, but the toxicity risk is higher if you take the high dose supplement over time. And for the water soluble vitamins with the B complex and the vitamin C, they circulate freely in blood and not stored. So deficiency develop faster with poor intake. The toxicity is less common, but can still occur if you intake high dose like supplement. First, we're gonna do vitamin A. Let's have another name is retinoid and carotenoids. With the popular form is retinoid, retinol, retinoic acid, provitamin A carotenoids. With its major function, it's really important for a reason: epithelial cells differentiation, immune function, and gene regulation. For a reason, the key idea is that vitamin A forms retinol, which is part of light-sensing pigments in retina. That leads to a classic deficiency progression, which is impaired dark adaptation. That means you have trouble seeing dim light, and it can cause night blindness, and severe deficiency can damage epithelial surface of the eyes, leading to xerophthalmia and potentially blindness. You might also see dry skin and increased infection risk because epithelial tissues and immunity are affected as well. Toxicity is important. The risk is higher with high dose supplement and preformed vitamin A with retinol or retinic ester that can cause symptoms like headache, nausea, liver toxicity, and in pregnancy it's increased the teratogenic risk. In contrast, high dietary carotenoid from fruit and vegetables typically usually do not cause the same toxicity. Sometimes they cause carotenemia, but it's just kind of like yellow or discoloration. And we're gonna move to the next, which is vitamin D, which is also fat soluble, but is act like a hormone. Vitamin D help regulate calcium and phosphate balance, supporting bone mineralization. The body can make vitamin D, but it still behave like a vitamin when sunlight exposure and intake is not enough. The activation pathway, if go to skin, it's gonna be the UV exposure, and then it's gonna transform to a vitamin D3, which is color calciferol, and within the liver, it's convert 25 hydroxy vitamin D, the main circulating form, and then for your kidney, it's convert 125 dihydroxy vitamin D, the active hormone form. So why the toxicity happens? Because vitamin D increase intestinal calcium absorption. Excess vitamin D cause hypercalcemia, lymph weakness, kidney stones, and soft tissue calcification. And then we're going to move to the popular antioxidant vitamin, which is vitamin E, which is the main form is alpha tocopherol, and vitamin E is the main chain-breaking antioxidant in lipid membranes. It interrupts free radical chain reactions that damage polyunsaturated fat in membrane. So if we lack of vitamin E, it may lead to fat malabsorption disorder or premature infants. The signs can include neurologic problems and hemolytic anemia. Because it's fat soluble, large supplemental dose can accumulate. Very high doses may increase bleeding risk by interfering with vitamin K, dependent clotting. So we're going to move to vitamin K since we mentioned a little bit of it. So vitamin K supports encapsulation of glutamate residues on specific proteins, and act like an activation step that let clotting protein bind calcium, which is necessary for normal coagulation. Vitamin C depends protein include clotting factor 7, 9, and 10. Protein C and S. Vitamin K also affects bone proteins such as osteocalcin. Deficiency causes bleeding. Newborn are high risk because they have low stores. Breast milk is relatively low in vitamin K, and gut bacteria aren't established. So vitamin K short prevent hemorrhagic disease of newborn. And now we move to water-soluble vitamins. They most act as an enzyme cofactor in energy metabolism and biosynthesis. So we're gonna we're gonna like the best theory approach for water soluble vitamins is vitamins and their active coenzyme form and the pathway, and then the deficiency syndrome. So most vitamin B function as coenzyme in metabolism. Deficiency can develop faster because they are stored in a large amount, except vitamin B12. Okay, so the first three vitamin B complex is vitamin B1, B2, and B3. So for the B1, which is thiamine, and the active form is TPP, and the role is carbohydrate metabolism, which is decarboxylation and transcrystallase. And then if we lack of vitamin B1, it's lead to beriberi, which is like wet beriberi and dry beriberi. And also there's another one is like Renico-Korsakov. Mostly appear like in alcoholism. For the B2, what is riboflavin, the active form is F18 and FMN, and it's appear in the redox reaction, what is the electronic transport chain and the beta oxidation. And then if we lack of it, we have chelosis, cholestasis, and dermatitis. And for the B3, which is niacin, the active form is NAD, NADP. You can see it in redox reaction, ADP, rapidylation, and signaling. And if you lack of it, you have like pellagra, which is dermatitis, diarrhea, and dementia. If you have like high dose niacin, it can cause flushing and possible hepatotoxicity. And then we move to B6, B12, and folate. B6, the active form is PLP, which is an amino acid metabolism, neurotransmitter, and neuropathy. If you have the high dose of vitamin B6, you'll have like the sensory neuropathy. And then for the folate, the active form is THF. This is one carbon transfer for DNA synthesis. And then if lack of it, we're gonna have like megaloblastic anemia, which is the neural tube defect. And then the B12 is required in methionine synthase and methylmalonins CoA mutase. If lack of, we're gonna have megaloblastic anemia and neurologic problem as well. Only B12 deficiency causes neurologic symptoms and elevated methylmalonic acid. Folate deficiency does not elevate methylmalonic acid. For the vitamin C, which is ascorbic acid, the major role is this a cofactor for collagen synthesis. Weak collagen is made on the scurvy symptom, bleeding gums, bruisings, poor wound healing, and joint pain. Vitamin C also improves iron absorption by converting Fa3 Oh, we got some disconnected. So right now I'm gonna move to the next. I'm gonna continue. So if you vitamin C also improve iron absorption and by converting Fa3 like Fe like iron 3 to iron 2. So high doses may cause GI upset, and it's usually you can see it like if you use it too much in the supplement, it's gonna affect your GI tract. And for the mineral, why we need them? There's like two common deficiency. Which is iron is needed for hemoglobin. The deficiency causes macrocytic anemia, which is fatigue and weakness. Its causes include the low intake, poor absorption, or the blood loss. And the next one is iodine required for thyroid hormone deficiency causes goiter and hypothyroid effect. In pregnancy, can impair fetal neurodevelopment. And we have some functional role that vitamin cannot replace. So about the structural, which is calcium, phosphorus, and magnesium. Low calcium and vitamin D lead to poor bone mineralization. And for the electrolytes, which is sodium, potassium, and chlorides, is imbalance, and the muscle and the nerve dysfunction. The enzyme cofactor with the iron, zinc, copper, and selenium is lead to iron deficiency and lead to anemia. And for the hormone component, the iodine is, like I said before, is the thyroid hormone. Yeah, it's lead to goiter. Yes. So the key takeaway for this video, what is micronutrients are required in small amount, but the effect for our health is big. For the fat-soluble vitamins, which is A, D, E, K, is dependent on fat absorption and have higher toxicity risk. For the water-soluble vitamins, mostly at cofactor deficiencies called classic syndromes. Minerals support structures, electrolytes, enzyme, and hormone, both deficiency and excess matters. So the best strategy to intake, which is from fruit, if on a supplement, but you have to limit it. And next we're gonna move to the knowledge check. From what we already been through. So a patient with a fat malabsorption disorder is most at risk for a deficiency of A, vitamin C, B, vitamin B12, and C, vitamin A, and D is foliage. So it's going to be the vitamin A, because vitamin A is the only one with is fat-soluble vitamin for that required for normal fat absorption. The next one is which vitamin required for encapsulation are clotting factors. What is vitamin K? It's activate clotting protein to bind the calcium. What vitamin deficiency is classically associated with night blindness is going to be vitamin A. It's the retinol for visual pigment. A strict vegan is increased risk of deficiency of B12 because it's mostly from non-vegan food, like from meat, protein. Elevated methylmalonic acid most strongly suggests deficiency of B12, vitamin B12, because it's elevated MMA, but the folate is not. And this is the references that I use for the presentation. Thank you so much for hearing. Thank you.